Part 2 of the smoking cessation station. If you want to know what I'm talking about, you have to slide in the first part and watch it. Now, carrying on with the management. So, we've talked about the craving that you need to tell the patient, be aware of stress, be aware of being around people that smoke, be aware of alcohol. You want to carry on with how can we help you manage cravings? So, if you're craving a lot, what should you do? First, you can exercise. That would be helpful for you. Second, sorry, explain to the patient that if you took a whiff, that whiff is gonna get you down the very dirty road because you're not gonna be able to quit any. It's gonna be hard. So when we tell the patient to quit, we tell them to pick a day. This day they're gonna cut completely. It's not like weaning down. No, we don't wean down. We don't step down smoking cessation. We cut down today completely. That's it. Of course, then we mentioned to the patient it would be helpful to change your routine. If you like to put something in your mouth, perhaps a pen, because some patients genuinely just like the feeling of something in the mouth. I don't know why. I don't smoke. Then if the patient showed, let's say I am the patient, I told you no, I'm not really that much interested. I'm smoking because I want to lose weight. Okay. So doctor, if I stop smoking, am I going to gain weight? What are you going to say? Are you going to say yes or are you going to say no? You have to be very diplomatic, very politically correct. You have to say, I'm not gonna lie to you, it does happen sometimes. Some patients, when they stop smoking, they feel the need to put things on their lips or in their mouth, so they eat a lot. Also, when the nicotine drops in our body, our appetite increases. So you could possibly gain some weight, although you always give solution. Although you can work out, you can go to the gym, you can take it as an opportunity to start cycling, for example. I cycle, why not? Then you start with, all right, so I can refer you to a smoking cessation clinic to help you with that, with a little bit of therapy. We have nicotine replacement therapy if you're fine with it. We have these two medications. The first one is Varenicline and the other one is bupropion. My pronunciation is not the best. Don't bother me. Anyway, nicotine replacement therapy. Make sure to know at least one or two formulas because the patient might say, oh, I prefer the patch or I prefer the gum. So make sure you know at least one or two. Then the patient might ask, which one do you recommend? Bupropion or Varenicline? That's when you guys absolutely must check the NICE guideline for the difference between these two and what you need to give. And also read a little bit about nicotine replacement therapy. And that's it for